Hello, everyone, and welcome back. Today, we'll be looking at intelligence gathering, or what is called as need assessment. And this lecture is divided in two parts today, and the next lecture will also be following intelligence gathering and need assessment. Need assessment, as you all have already been doing as part of your assignment one. All right, so yes, why is this important? Understanding and learning how to do need assessment, or it's also called as parts of it are called as problem analysis or determinant analysis, because with any project that you start during your placement or during your internship, um, or else during your work position, future on in your careers, the first thing which you do with any new project is intelligence gathering or need assessment. So yes, as I had shared this example with you previously, that not knowing the basics of how to do intelligence gathering or need assessment can look very poorly when you are applying for job positions or when you are on your placements. And therefore, it is important to not just theoretically understand these concepts, but know how to apply them in practice. And therefore, your first assignment is principally based on you undertaking needs assessment. All right. So, and we will see further on how and what part of need assessment are you actually doing in your assignment, and what are the other components of need assessment as well. All right. Therefore, this is important because all of your new projects, irrespective of what you're doing, starts with the very first step, which is needs assessment. And it is important for you to understand how you should be doing this. Okay, so guys, there are several steps to this, and you can look at these learning objectives in your own time. So yes, how are we going to be understanding needs assessment and the entire program planning cycle? So a very renowned Australian professor and dietitian, Professor Roger Hughes, has created the Bi-cyclic framework for public health nutrition practice. All right, so now this some framework is not created by some sociologist or some policy maker who has no idea about public health nutrition, but it's been created by a Australian nutritionist and a renowned professor, Professor Hughes, and therefore this framework is highly applicable to our dietetic and our nutrition setting because it's been created by a person who has immense knowledge and expertise about how to amalgamate public health and nutrition together. All right. So, yes, what we will be doing is throughout this course, what I'll be making you do is understand and apply the bicyclic framework or public health nutrition in a simulated setting in practice. All right. So, your first assignment is essentially intelligence gathering, all right, which is what you are doing, needs assessment. Your second assignment is an amalgamation of intervention planning and implementation. This is where I'm hovering my mouse. So intervention planning and implementation. And you're also doing a evaluation in terms of process evaluation and impact evaluation. Of course, you're not doing the long-term evaluation, but as you can appreciate, because we are just together for 13 weeks. All right. So yes, you're doing the entire bicyclic framework of intelligence gathering action, meaning the actual implementation and the evaluation in a classroom simulated setting. Okay, so this is what I called as the program planning cycle, and this is what is called as the bicyclic public health nutrition framework. Okay, so yes, you are learning all components of it. So basically what happens is when you go on placements, you are asked to do one or more component of this. Either for your 6 weeks of community placement, you will be asked to do intelligence gathering, or else plan, design, and implement an intervention, or else you may be asked to do evaluation, or two components together. So maybe intelligence gathering and say intervention implementation, or else it could be say intervention implementation and evaluation. So this is how you are asked to be say this is how your projects are in your placements. But the benefit of this unit is that in a simulated setting, you are practicing all components of the program planning cycle. Okay, so yeah, so we'll go with the step one, which is community analysis and engagement. This is the first step of your intelligence gathering process. So in your first step, community analysis and engagement, and now I'm talking about engagement, is to first identify what already is existing in the community. All right. So for example, existing community resources such as say at Voluntarily, when I wanted to create the Voluntarily, say, diabetes program in terms of, say, prevention and in terms of management, the first thing which I investigated what already is existing in the community which can support the intervention, which can support the Voluntarily diabetes program, WDP. All right. So yes, so I found out that yes, the Voluntarily Shire has a community pantry where I told you about the free fruits and veggies. That's the one. It has community walking groups, not just by the Heart Foundation, but they have their own community walking groups in the Wollondally Shire. All right. And yes, they have community gardens in which you have gym sort of equipments, so on and so forth. All right. So first, what I did was I scoped out what is already there in the community. Second thing, I wanted to investigate, are people aware that there are so many resources already existing in the community? So this was by connecting to the locals, formally and informally, having a chat with them, or else having focus groups with them, to understand that are they aware of these resources, and not just having a chat with locals, but also the council officers, the project officers, say the Voluntary Council, the which is associated to the Southwest Sydney Local Health District. So having these sort of meetings to understand, um, are people aware of these resources? What are the challenges and barriers which are, say, which are preventing individuals from accessing these resources and leading a healthy lifestyle? So all of this community analysis and engagement is, say, the background work which you do before you start a formal need assessment. Okay, so this is more informal surveying of the community. Then utilization of community resources, which is, for instance, what I understood, that the Voluntary Shire is a very strong knit community, and the locals in the community, especially the elders in the community, who were at the high risk of having, say, diabetes risk and diabetes management, who needed the intervention, they were a very close knit group. And to make this intervention sustainable, it is important to have leaders out of the community group. All right. So to have active elderly individuals who do not just want to be a participant in this intervention, but who wants to take some sort of a leadership role, like a peer support facilitator role. And I have told you the concept of peer support facilitator in the last lecture when I was talking about behavioral models. All right. So yes. So what I saw was that yes, I'll be having a participant audience who will be receiving the intervention. But the second group that I need to train are peer support facilitators, because they will be the mediating chain between the participants or the community and us, the researchers or the dietitians and the allied health workforce, who are trying to reach out to the community. All right, then utilization of community resources. So that's the one which I explained. Tailoring the intervention. So tailoring the intervention is similar to utilization. First, I surveyed that for my intervention to be successful, only I having a 8 week session and working out is not going to make a difference. So that was, say, utilization of community resources. I need to create champions within the community. Tailoring the intervention was me discussing with my supervisor, Professor David Simmons, that and as per his advice and expertise, this is what we created, a model where we are having interventions not just for the community members, but we are also having interventions to train peer support facilitators who are local community members, but they want to take up more of a leadership role. All right, so that is how we tailored the intervention to hopefully make the intervention successful and sustainable in the long run. Then community participation, because we had peer support facilitators on board, they were a very big engine to recruit participants, because they were local community members. They knew a lot of local individuals, and they were one of the biggest medium for us to attract participants into the voluntary diabetes program. Okay, so this is what enhanced community participation. And sustainability. So yes, since my exit from the voluntary diabetes program in 2017, the program has been successful, where we still have peer support facilitator champions who are working with the community. And although it is not 100% successful, but still there are these championship individuals, peer support facilitators, who are still supporting the local community members, and at least are helpful, because now they have the knowledge to advocate healthy lifestyle for diabetes prevention. Of course, not management, but for prevention. All right, so yes, this has been successful. Of course, not to the extent which we wanted, but some success is better than no success, especially when you're dealing at a community level, at a population level. All right, so yep, second is community analysis. How do you do community analysis? You do community analysis by, say, connecting with the community members, and that is something which I covered in the last slide as well. So engagement and analysis is quite hand in hand. All right, so basically you do a community analysis by meeting local experts. Now, these local experts, as I said, were not just leader members within the community, like who we thought would be really great peer support facilitators, but even local council representatives, the voluntary shire council members, project officer, program officer, government alliance officers, and then of course also reviewing the existing literature, which is the voluntary shire health report, and reviewing whatever literature we could get our hands on. All right. So yes, so history, demographics, social factors, all of this you come to know from the local government documents, which are available in the voluntary library and even online. Then health reports, again, health reports, we procured this from, yes, the literature which was available, but even making contacts after ethics application, of course, with medical centers, and getting the de-identified health data for us to know what is the, say, status of the health of individuals who are accessing medical services in voluntary. All right, and values and beliefs and norms of the community, you get to know this more again from local experts. All right, elderly leader members in the community. So yes, the second step comes to problem analysis. So problem analysis, the first step of doing problem analysis is what you're already doing in your assignment. You want to find out that why is the community experiencing the problem and what is the problem. All right, so you want to find out what is the problem. Okay, so what is the problem is what you're doing as part of assignment one, part one. And when you're meeting your mentors, and your mentors are giving you a broad overview about the project topic, and the meeting which we have had, in which I have given you a detailed overview about what your project topic is. For example, your project topic could be on diabetes, on obesity, on depression and mental health, so on and so forth. Okay, so what is the problem of your target audience is something which has been given to you by your mentors and by myself. This is called problem analysis. And when you are in real life, this is something which is flagged to you by your supervisors, and then you go further and you investigate what the problem actually is. Okay, so you are doing this as part of assignment one by having meetings with us and then collecting literature review on the topic. All right, the other methods of problem analysis are, we are going to look at each of these briefly in detail. So the first one is survey and questionnaires. These four methods, they are the practical part of problem analysis, all right, or needs assessment. So the practical part meaning, as part of your assignment one, part one, you are doing the literature review, which is the theoretical aspect of need assessment, which everybody does, all right, whenever, be it at placement, internship, or at work site. The first thing which you do with need assessment is a detailed theoretical review. Then you start with the practical aspect of need assessment. Practical aspect of need assessment you can do via these methods, which is, say, surveys or questionnaire, which could be both qualitative and quantitative in nature. You can have these surveys and questionnaires done in form of interview methods, one-to-one or focus group. All right, and these surveys and questionnaires are not just with your potential participants. These could be with local council members And this could be with the funding body, this could be with the government body. So depending upon who your stakeholders are. Now, Delphi methods, which is more qualitative in nature, this is done when your stakeholders are geographically dispersed, meaning they are all over Australia. Delphi method is generally done with experts in that area, and you want to take their consensus, and you want to come to an understanding as to what the problem the community is facing, why is the community facing a problem, and you want to discuss potential solutions for it. But you want to gain all of this information from experts in that space. All right. So, for example, with us, the Delphi method involved having meetings with, say, the endocrinologist who was working with the community in the Bulundali, the GPs who were working, the nursing staff who were working with the community members in Bulundali. So these were all experts who have been dealing with the health issue, and for us it was type 2 diabetes. So we were discussing about all type 2 diabetes, but we were wanting an expert's opinion on it. What is their reflection through their number of years of experience in dealing with the community members within the community sector. All right. So basically, Delphi method done with experts to get an understanding of their experiences and their consensus on the problem which you're dealing with. And in this example, for example, it is type 2 diabetes. Okay, then you have observational methods, which is again qualitative in nature. And in this method, generally what is done is you may have one or more researcher, generally it is one or more researcher who are practicing proactive listening and active looking. All right. So meaning, for instance, when we were doing focus groups with the community members. All right. So for instance, community members meaning our potential participants for it, and it was in a problem analysis stage where we wanted to understand what are their challenges and barriers for not accessing the say healthy lifestyle options which they have in Wollondali, such as they have community parks and community walking groups and the pantry. Why are they not accessing these services? All right. So for us to gain an understanding of this, we had done a focus group with the community members in Wollondali, and there were two researchers who were just observing this interaction, and they were taking a record of this. This helps with fidelity checking as well, and to take down key notes. So this is called observational method, where you are recording a lot of rich data by just being observers. And of course, we as me and myself, one more, we as active dietitians who were actually doing the problem analysis, we were practicing a lot of active listening as well. Why? Because you don't want to probe answers. You want to guide them. You want to guide your question to get maximum information, but you don't want to give answers because you want to understand their perspective, because there is no right and wrong answer in a focus group. You just want to gain their perspective and their understanding of the problem. All right, so then you have in-depth interviewing. Again, this is qualitative in nature, and this could be done with participants, experts, locals. Generally, this is done with elderly community leaders. All right, so for example, you have this was so at Western Sydney University, my professor, Professor David Simmons, he is still also working on another project, one of his million and other projects, which is on the Samoan population. And for instance, in this case, it was very important for them to have in-depth interview with, say, community leaders to understand the, say, the cultural background, and to understand the cultural sensitivity of where this issue is stemming from, and how do they address an intervention which is culturally respectful and appropriate. To do this, it was very important for them to have meetings with community members and invite community leaders in planning of the intervention and in parts of the delivery of the intervention as well. Okay, so yes, this is just a broad framework which I have created for you for the problem analysis. And this template, of course, is also available in Professor Roger Youth's textbook, which is what I have cited in those notes section of the PowerPoint. All right, so the problem analysis template, but I have just completed an example for you so you know how it's working. So with the problem analysis template, you first ask what is the problem. So let's look at some other problem over here. because you would be tired with the voluntary example. So let me share with you another problem, which is you have, for instance, high prevalence of overweight and obesity among the South Asian population who are accessing the ACT healthcare services. And this is no new news, guys. For example, Kathy and I, we are working on something which is called as the BOSS data set, which is after ethics application, which is taken from ACT Health. And yes, there is a very high, say, prevalence of overweight and obesity among the South Asian population in Canberra. All right. So where did we get this data from? For instance, we got this data from ACT Health, say, report, and from their data records by discussing with the ACT Health program directors, such as, say, Pip Gawley. All right. So yes, from experts within the field and from the records available by the ACT Health and government, we got this information. So from where we realize, yes, this is a big problem within the South Asian community. Then who does this problem affect? Yes, it affects the South Asian, and how many are affected by it? The data showed, for instance, 3/4 attending these services are affected, the South Asian community. And where do you get this data from? The same resources which I mentioned. Literature review, governmental reports discussing it with, say, expert stakeholders like the program directors. Then what are the consequences of the problem? So of course, you have a lot of evidence out there, systematic reviews, meta-analysis, which have shown the, say, negative implications of overweight and obesity among the South Asian population, particularly among the South Asian population because of high adiposity. And if you're not aware, you should be aware of the Barker's hypothesis, the thin fat baby syndrome. Concepts like this I cover in nutrition and disease, but if you're not aware of this, please look this up, because this is a common, say, phenomena among the South Asian community. And as a dietitian, you will be working with multiple cultural groups, and therefore you need to know what this thin fat baby syndrome means. Okay, so it's a clinical concept, and I won't be covering it over here because then I'll start with a clinical nutrition lecture. Okay, so I'll just stop over there. But yes, the consequences we are well aware of. And where did we get this information from? From the existing literature. All right. Then you have, what are the consequences of doing nothing? All right. So yes, of course, this will increase the, say, burden on the healthcare system in terms of finance, in terms of even consequences on the individual, in terms of quality of life, and in terms of, say, secondary complications because of obesity. So yes, it is a big burden, not just on the economy, not just on the government, but even on the individuals who are facing overweight and obesity. Okay, and where do you get this information from? Again, that's the third column whenever I'm talking about this. So that's again from original articles, reviews, governmental reports. Then, are the issues important to community members? Yes, they are. Because when we had done focus groups with the South Asian community, they had expressed that yes, 70% of them were concerned about their weight status, and say nearly like 50%, which is say 45%, they were willing to have lifestyle changes and improve their, say, choices, dietary choices, so on and so forth. So this was done by, say, having pilot programs with placement, to do a short need assessment, practical need assessment with the participant audience. All right, then are resources available to support address this issue? So yes, ACT Health was happy to provide funding for a small outpatient clinic for, say, particularly the ethnic community members. So you can tailorize dietary interventions and patient education resources which are suitable for this audience. All right. So yes, they were happy to do this. But yes, this was in discussion with the ACT health program directors, the higher ups, that they are happy to have this funding, but to them to release the funding, you have to first pitch with evidence and show that yes, this is a real life problem. All right. So how do you show this is a real life problem? By two things: theoretical review of the existing literature. This not only includes original articles and meta-analysis, but also government documents, and a practical need assessment, meaning you may have interviews, focus groups with the potential participants, which is the South Asian community accessing the ACT healthcare service, but also with, say, other stakeholders within ACT, such as the dietitians and the project directors, so on and so forth. Okay, so now step 3 within the intelligence gathering process is stakeholder identification and analysis. So your stakeholders are at various levels. So this diagram shows your various levels of stakeholder, and we'll be going through these ones to give you an example and an idea. So let's take another example now to further your understanding. So if you have a topic such as promote healthy eating among primary school children at the Aranda Primary School using a healthy eating rewards app. Okay, so your main aim is you want to promote healthy eating among these school children using this mobile app. Okay, so who are your core stakeholders? Okay, your core stakeholders is your intervention team, the team who's going to execute the intervention. Okay, so this would be the say the governmental sector, for example, University of Canberra, supported by the government. Okay, it's a public organization and institution. It could be the University of Canberra. If you are working in ACT Health, the government sector could be the ACT Health, for instance. Then it could be the health related sector. What if you're working with an NGO like Nutrition Australia? So yes, whoever is joining hands to execute this intervention, these are your core intervention management team. Okay, so core stakeholders. Then you could also have non-health sectors, such as you may have IT experts who are going to help you develop this app and who are going to play a big role in executing this intervention. Then you have your involved stakeholders. Involved stakeholders are, for example, they could be they are part of the intervention, but they are say they have a passive role or maybe a receiving role. For example, school authorities in the Aranda Primary School who are going to give you the permission to undertake the intervention, conduct the intervention in their school grounds. Okay, so it could be the school authorities. Then you have supportive stakeholders. Now these could be indirect stakeholders again, who may impact your intervention in some way or the other, and that's why you want them involved in some capacity. This could be, for example, the restaurants or the grocery outlets or the food outlets which are around the school. This could be the say the ACT council office or the program or the project officers who are working with ACT Health and the council. All right, then you have peripheral stakeholders. They just need to be kept informed. All right, so about the progress and about what's happening. So for example, these could be your funding body, the people who are going to give you the money to actually execute this intervention. All right, so they are going to be giving you money to hire research assistants for implementing the intervention, for say printing the resources and for any other things which you need. Okay, so basically they are the ones who are going to be funding. Then stakeholders, then you may have some stakeholders which are excluded. For example, what if your aim is to pilot this intervention first only in Aranda Primary School, see whether it is successful or what changes are required before you start implementing this intervention in other schools around ACT. Okay, so in this case, you want to exclude all other school. Right now, your focus is only Aranda Primary School. Okay. You may want to exclude other industry partners at this moment because you're just piloting a raw intervention for the very first time. This could be, say, maybe big industry partners such as Coles, Woolies, all of that. All right. Yes, but see, it happens in stages. Maybe in the second stage, you may want to invite, say, big industry partners such as Coles and Woolworths to partake in your intervention. Okay, so it is not that you are excluding them because you don't like them or you have a bias. No, sometimes you want to have a systematic stepwise approach. So they are manageable small steps, and that's why you don't want to just launch big, especially if you're piloting interventions. Okay, so then you have stakeholder analysis. How do you do stakeholder analysis? Basically, you have intense meeting with your stakeholders. A lot of the time, you may have meetings only with your immediate stakeholders, like daily, say, weekly meetings. Then you may have, say, monthly meetings with your, say, funding bodies and peripheral stakeholders. Basically, analysis meaning you sit together, you brainstorm ideas as to what is needed to be done, how it needs to be done, what is the timeline, how are you going to delegate the responsibility. So all of this decision making is done during these intense say meetings and these say committee sessions. Okay, so these sort of working groups, these are also called as working groups, steering committees. Again, these are very important words for you to know. Why? Because they are generally used a lot in the workforce scenario. All right, this is just the examples which I've given you, that you may have a project manager, coordinator, RA, representative, attending these weekly meetings, so on and so forth. And what I have done, guys, is because a lot of time in placement, students are required to make such meeting agenda and meeting minute items. And sometimes they get really overwhelmed because they have never made a meeting agenda or recorded minutes. So, and these steering committee meetings happen all the time for any sort of a project. Okay, so what I have done on Canvas, I have given you this document just as an FYI for your future. You don't require it right now. This is from the Wollondali Health Alliance. It's just a draft which I can share with you. It's a pretty old one, but see, it details a meeting agenda for you, and then it details the minutes for you. So you have an idea as to how do you make a agenda, how do you make a minute document or report a minute document when you have these steering committee meetings. Okay, so this is just an FYI for you to help you out maybe in the future. Okay, if one of your roles are pertaining to something like this. All right, so now moving further. So, yep, what does analysis involve? Analysis also involves, you may have, say, detailed interviews, focus group with your stakeholders, and these could be various stakeholders. You may have a detailed interview with the school representatives, then you may have a detailed focus group with the restaurants you are planning to involve as part of the interventions who are close to the school peripheries. All right, so it depends upon who you meet and what do you discuss, but basically analysis involves thorough detailed understanding and investigation of how you are going to plan and design your intervention by taking into consideration the key stakeholders' thoughts and opinions. All right, so yep, so this bookkeeping is done via recording of minutes and agenda, which is what I showed you, the Word document. Okay, then comes the determinant analysis. All right, so determinant analysis is basically, now you know exactly problem analysis, meaning what is the problem. Okay, and those were the steps 1, 2, 3. Those were the steps for problem analysis. Okay, which is what you are doing in your assignment 1, part 1 as well. Okay, then you have determinant analysis. All right, so determinant analysis is finding out the cause of the problem. Now you know what is the problem. Now you want to find out the cause of the problem. That is called as the determinant analysis. And determinants can be classified in various ways. And I have gone into details about how you classify determinants as per the precede proceed model, which is predisposing, enabling of and disabling factors and reinforcing factors. So I won't go into details of this again. You can also classify your determinants as modifiable factors, non-modifiable factors, and this is something which I have shown you when I have discussed your ethics application rubric, and I have taught you how to write the background, the introduction, and how you can classify causes as modifiable, non-modifiable. So that is one of the say ways of how I classify determinants generally. All right, and then the other way of classifying determinants is direct or indirect determinants. All right. So, and determinant analysis, how do you do? They were the same slides 10 to 13. Okay, so guys, determinant analysis you can also classify as direct determinants, which are called as proximal, indirect determinants, which are called as distal determinants. For example, your direct determinants could be that because the child is consuming a lot of discretionary food, that is why the child is overweight and obese. An indirect determinant could be that there is a lot of, say, discretionary food available on school grounds, and there is a lot of, say, advertisement of discretionary food items targeted towards children, and those are the factors which are influencing the child consuming more discretionary food. Okay, so like there are like many factors. This is just one example which I'm taking for you to gain an understanding of proximal and the distal determinants. Okay, so yes, depending upon your research question as well, some determinants may be, which are indirect, may become direct. For example, if your research or your project topic is say intervention for say minimizing children's say screen time, which is where they are exposed to all of these media advertisement about sugary beverages and biscuits and whatnot. Okay, confectionery items and stuff. So your intervention over here is to minimize their screen time and encourage physical activity, outdoors and indoors. Okay, so in this case, your determinant, which was just the media exposure, which was indirect, now has become direct. Okay, because your research question is such. So depending upon your project topic, research topic, you may then redesign your determinant flow chart is what I'm saying. Okay, so this example which I have given, this may, your determinants may be completely different in terms of its priorities depending upon your research topic and your project topic. So I hope you understand what I'm trying to say. Okay, and of course, it's not always linear, because as you see, there are so many branches and bifurcation, things which are interconnected. So it is not just a flow chart, meaning just a linear flow chart. There could be a lot more arrows which are cross lapping and overlapping each other. There could be a lot of bi-directional relationships as well. Okay, so then you have capacity analysis and building. And this I have spoken about quite in detail in your first lecture when I said that what do you mean by capacity analysis? Again, which was covered in detail in the first lecture, meaning you are enabling your audience to say absorb the intervention which you are providing them with. And not just that, but to make this intervention successful in the long run. All right. So basically, you're enhancing the capacity of the individual, meaning your participants. It could be a group like community, such as the Wollondally Shire. It could be the organization in a whole, meaning the stakeholders which are indirectly related to the Wollondally Shire, like the council and the project officers and the GP medical services. All right. And you are capacitating the entire system per se. Okay. So this is what is meant by, say, capacity building and analysis, meaning to increase their ability to perform the required action to meet your intervention deliverables. Okay. So this basically, how do you do capacity building? You do it via your intervention. Your intervention helps to build the capacity of the stakeholders of your interest. Okay, so this has been covered in your first lecture when we spoke about capacity analysis and building. And essentially, it is the same thing. You are doing capacity analysis as part of your assignment too, where you are, say, intervening your potential participants in a classroom setting, in a simulated setting, and you are increasing their knowledge and their awareness about XYZ topic. And therefore, you are building their capacity to carry out certain health behaviors which you want them to. Okay. So that is capacity analysis in action. You are actually doing it, okay, as part of your assessment. Okay, now the sixth step is mandates for public health nutrition, which basically in very simple terms, it means that whenever you are planning an intervention, whenever you are planning something, it is very important to see how is this aligning with the policy framework, with the government framework, with the national nutrition policies, with the strategic framework. Why is it important? Because you want to work on interventions, you want to work on projects which are of national priority as well. For example, if you're working on childhood obesity intervention, it is very highly likely that you will receive funding for childhood obesity, okay, because it is a national priority. All right. In India, for example, if you are, say, pitching for childhood obesity, till date, still the priority and the emphasis is more on undernutrition and starvation and death because of, say, undernourishment. All right. So the government will prioritize its funding and its strategic alliance with organizations which are working on undernutrition, in eradication of undernutrition, because that is their national priority. Whereas in Australia, the national priority is prevention and management of childhood obesity. So you're more likely to receive fundings in Australia for, say, addressing childhood obesity, in India for addressing undernourishment. Does that make sense? So it is very important for you to have a global understanding of what is the national and international priority of the context in which you're working in. This will help you to achieve your goals. All right. Okay, guys, these are just additional slides. These are just FYI, where I have just shared with you, because these are not directly, this is not directly right now needed for you, but I have given enough explanation for each of these for you to understand that what are certain challenges which are faced when you are, say, starting off community analysis and engagement, for instance. Okay. Yeah, so I've spoken about challenges, and then in terms of capacity analysis, I have also identified over here that you also need to report your capacity analysis documentation. You need to provide documentation evidence of each of these, and the documentation, which the example which I've given you is the Voluntary Health Alliance need assessment report. Okay, so they did a capacity analysis, they did a need assessment, and then they produced an executive report for the same. So you need to document all of these efforts that you're putting in. Step 1 to 6, these efforts need to be documented. And this is an example for the same. Okay, and then documents provided for, yes, you can have documents which are provided for individual level, group level, systems level. This document, which is there, the Voluntary Health Alliance, this is provided for the general public as well, meaning individual level. And it is also provided for the organization and the systems level, for the voluntary council, the voluntary shire. Okay, then you have capacity analysis, which is again, you may do it at say various levels, which is individual level, organization level, systems level. So basically this is all just additional information for you to have further understanding about this topic, but basically I have given you broad overviews about each of these steps, and you are practicing some of these steps as part of your assignment. All right, but if you were to prepare for, say, a community dietitian role, these additional slides will help you to have a better understanding of your role and what their expectation may be from you as a community dietitian or nutritionist. Okay, therefore, these additional slides. All right, and then capacity analysis. Again, there are various ways of doing capacity analysis. One of them is the focus group. The other one is called as forced field analysis. And I've explained to you what force field analysis is in this. So basically, all of this is not directly relevant to you right now, but it's good to have this information at the back of your hand in case if you're going into depths of, say, a position which requires you to become a community dietitian. Okay, so yep, so capacity building, how do you do this? By conducting, so as I said, essentially you can build capacity by conducting intervention, and which is what you are doing as part of your assignment too. Okay, so yep, so the other way of capacity analysis again is you have various tools which you have, scorecard list and capacity analysis matrix. So see, that is what this is all higher level community nutrition knowledge, not required at this stage, but useful to have it at the back of your hand. Okay, in case if you require it in the future. But yeah, so guys, that's about it. So don't mind my extra slides. I like giving these extra slides in case some of my students across the years, they have swapped to community dietitian roles or have had an opportunity to practice as a community dietitian, and they have let me know formally or informally that this is when these slides are helpful. Although they are advanced level learning, not required at your stage, but it will be helpful in the future. Okay, if your role demands so. So yes, guys, this is it for the current lecture, but we will continue with intelligence gathering and need assessment in your coming lecture as well. Okay, so yes, I'll see you soon and thank you for your time.